Good afternoon, and thank you for the opportunity to speak to you today about wearable, mobile, and remote monitoring technologies in oncology, current evidence, and future opportunities. This slide shows examples of what we refer to as wearable, mobile, and remote monitoring technologies for health. They range from wearable activity and sleep monitors to home-based devices for measuring vital signs. But what all these devices have in common are a few key characteristics. They all collect health-related measurements with the potential for clinical utility. They're consumer-friendly, and they require little or no clinician involvement for use. They include a sensor element and a software component that enables them to connect to the internet or to another device, such as via Bluetooth or an app. And they're portable, and they're intended to be used outside of a clinic or a facility. These represent tools for a new brand of multidisciplinary care and research because they offer an unprecedented approach to measuring key physiological and behavioral outcomes. And they do this through continuous and often passive data collection, which requires very little effort on the part of the user. They also can reduce barriers and limitations to traditional data collection, such as distance from a clinic or reliance on self-report. Data can be used to identify early intervention signals that can help prevent or mitigate problems during cancer treatment. And the transition of data is wireless and seamless and enables for a large capacity of the ability to store large amounts of data. The overall goals are that these devices and systems are scalable and cost-effective. In the era of COVID, these also may help us reduce reliance on our typical in-person and physical contact that we're used to in cancer care. They also may facilitate transition to remote clinical trials by enabling remote data collection and interactions, and they might be able to be used in enhancing virtual visits. And at my own institution, we are embarking on a study that's using home-based digital monitoring for COVID-19 in conjunction with validation of a COVID symptom patient-reported outcome measure. The adoption of these technologies in cancer and the potential for doing so is driven by the high adoption of mobile technology use among consumers. A growing proportion have used cellular technology over the years, and most recently, the majority reporting to own smartphones. And this is increasing across all demographic groups. Most cancer care also is experienced away from the clinic setting, even outside of the era of COVID. And so the opportunity to incorporate remote monitoring can help us monitor patients at a distance for varied and complicated side effects from their treatment, and also may offer less burden for clinical trials participation because they may not need to come to the clinic for visits related to their trial. In our own research, we found that acceptability, feasibility are fairly high when the technology is perceived as adding value to their care, so when they see it as beneficial to their treatment. However, recently a large survey of patients, over 1,000, with chronic health conditions, including cancer, reported mixed responses about the acceptance of wearables, expressing some concern that this may cause them to lose in-person contact with their healthcare providers altogether. So in sum, we need both a high-tech plus a high-touch approach to incorporating these devices, an ongoing attention to patient engagement to make sure that patients are engaged and continue to use these technology innovations. This slide shows the inclusion of connected digital devices in clinical trials over almost a 20-year period. And as the chart shows, we've observed a compound average growth rate of 34% in the inclusion of connected digital devices in clinical trials based on data from clinicaltrials.gov. These have been used in 4 primary methods. 1 is to validate the functionality of devices, 2, to test their clinical usability and feasibility within different settings, 3, to capture endpoint data, such as step count in studies that have implemented physical activity intervention trials, and 4, finally, as digital therapeutic interventions in and of themselves. The most commonly used devices have included smartphones and mobile apps, followed by activity devices, including actigraphs and Fitbits, both of which are wearable devices. However, it's important to note that in 2018, the most recent year for which data were reported here, only 22 out of over 1,000 trials were in cancer. Wearable physical activity monitors have been one of the most commonly used devices, wearable devices in clinical trials. And these typically, traditionally have included research-grade accelerometers that have been worn on the hip or the wrist. However, most recently, there's been a greater interest in the use of consumer-grade monitors and trackers on the smartphone that will track many of the same parameters, including step count, sleep, heart rate, and energy expenditure. And these are very powerful or have very powerful potential because they provide immediate feedback on step count. And that, combined with behavioral strategies such as goal setting, may improve activity levels. And while physical activity recommendations don't specify specifically step count goals for activity levels, recent evidence shows that higher step count is associated with lower all-cause mortality. In contrast, sedentary behavior is associated with higher cancer mortality. Most oncology studies that have been using wearable monitors have focused on changes in activity levels as the primary outcome. However, more recently, there's been an interest in looking at wearable activity monitors and their application to other areas within oncology. And one area is within the use of predicting performance status, which is a widely used measure of physical function and overall well-being. So some of the questions are whether wearables can improve the accuracy of performance status and physical function assessment, can they reduce bias in assessment, and can they help guide and monitor therapy? So preliminary findings have found positive correlations between step count and performance assessment, performance status as assessed by providers, as well as important outcomes in patient-reported outcome measures. Studies have also observed increases in steps per day associated with fewer hospitalizations and adverse events and better survival. And my team and I are embarking on an intensive longitudinal evaluation of physical activity, performance status, quality of life, and clinical outcomes. So in addition to looking at devices individually, there also is an interest, and I think a growing move toward looking at connected digital devices in conjunction with electronic patient-reported outcomes in multifunction platforms that capture a number of different parameters simultaneously. These are a couple of studies to illustrate that. One of gynecologic cancer patients undergoing palliative chemotherapy, in which the platform captured activity, heart rate, and electronic symptom PRO measure, with symptom management guidance that was tailored to specific response thresholds on these measures. On average, there was a high rate of completion of all these assessments, and the study identified a subsample with a cluster of multiple worse outcomes. In another European study of home-based chemotherapy for advanced GI cancers, sleep, body weight changes, circadian rest rhythm, and symptom electronic patient-reported outcomes also were captured, again, with provider intervention tailored to specific response thresholds. The completion was above average, and based on the provider interventions, the study showed that patients were able to tolerate a multi-drug regimen. This is a study we conducted within my team looking at monitoring for dehydration risk during radiation treatment for head and neck cancer, combining electronic patient-reported outcomes, home-based Bluetooth-enabled blood pressure and pulse monitors, and also a Bluetooth-enabled scale to monitor weight loss. All of these readings were combined into our multifunction platform called Psycor, and were aggregated to provide reports to providers that would indicate whether or not patients were exhibiting early signs of dehydration. The patients completed 85 of the assessments during the 6 to 7 week period of radiation treatment, and in the group assigned to remote monitoring, they reported fewer symptoms and better quality of life. So considering how to advance the use of mobile and wearable technology in cancer clinical trials, there are a couple of frameworks to consider which address concepts such as feasibility, validity, and clinical utility. And these are important because it's important to consider patient acceptance, satisfaction. With regard to validity, you want accuracy and predictive capability. And with regard to clinical utility, you really want to make sure that the data that you're capturing really meaningfully informs clinical care or research. The Clinical Trials Transformation Initiative also has published recommendations on digital health technologies in trials and has a database of feasibility studies incorporating digital health technologies. Of note, of the over 400 studies in this database, only 12 are cancer trials, and 10 of those focus on physical activity. So in summary, I'd like to propose some future directions. One is that we need to increase the evidence base for the use of connected digital technology in cancer and expand the focus beyond the use of activity monitors and identify and test patient-centered use cases that address the cancer continuum from primary prevention to long-term survivorship. And perhaps during the disruptive age of COVID-19, we might be able to identify opportunities more immediately for innovation. We also need to assure the infrastructure is available to support access to mobile and wearable technology, particularly among underserved populations, as there can be potential disparities in access to these among populations that might most benefit from these most. And finally, to incentivize the creation of a connected digital ecosystem, and that's to focus on the having interoperable components that have open interfaces in order to help accelerate the development of new and multi-component systems. Thank you very much.